Hello, my name is Oved Palacio and I'm a student at Franklin University. Today we are going to talk about a patient of mine that came to the clinic. He came just for a regular follow-up visit so we can discuss his chronic conditions. We're going to take the opportunity for discussing about end-of-life goals and wishes for this patient. As I mentioned before, my patient is an 80 years old male patient. He is Hispanic and there's no cultural concern. He is alert, oriented times 4, and well presented. He is very aware of what's going on around him. The patient is a good historian and has a good memory recall. Talking about a little bit of the HPI, this patient came today just for follow-up. Some of the conditions that the patient presents includes diabetes mellitus type 2, hypertension, BPH, high cholesterol, and also the patient has a history of skin cancer. The patient has been following up with oncologist every year since completing the treatment. Last time that he went to see the oncologist, everything was normal. There's no new issues presenting to the patient. There's no lesions that he just noticed. Everything has been normal. The patient reported that there's no new complaints. He's been stable. The blood pressure has been controlled. He stated that he's taking his medication as prescribed, not only for the blood pressure, but also for the hyperlipidemia. And he's on top of the medication for the prostate. The last time they checked the PSA level, it was 4.6 and it's been stable since then. The urinary symptoms still happening, especially at night when he needs to wake up a few times to urinate. The patient has stated that he's taking all his medications, like always, and there's one thing that he doesn't like to get in is the flu vaccine. We recommend it, but the patient still insisting that he doesn't need it. The last time that the patient has a colonoscopy was 5 years ago, but at this point I would say the patient graduated, so we're just monitoring any symptoms if something is coming up. The patient has not reported any allergies that he's aware of. He used to be an electrician. He's retired at this point, of course, and he's living with his wife and he's not sexually active. The patient denied smoking or drinking or using any type of drugs other than pharmaceutical as prescribed. During the evaluation with the patient at the office, we start talking about why the patient needs to have a proxy, a healthcare proxy, and we explain the importance of it. We suggested the patient to have somebody assigned for any situation. During the conversation, he mentioned that his wife is already the person assigned, and they have discussed this for a long time. That if something happens, she will be the one making decisions for him in case he's not able to. The patient's wife was present during the visit. They have a very good relationship, and she is aware of all his medical conditions that also make her qualify for him to choose her as a healthcare proxy. During our conversation about healthcare proxy assignment, the patient was calm. He was related to these questions and he was with a normal reaction. He knew is part of the conversation, mostly when he's going to the hospitals. Any admission for the hospitalizations, there's been none in the past, in the recent past, but the last time he was admitted, they asked him to fill out the paperwork. His family members are very supportive, and they all know that his wife is the one that makes decisions when he's not able to. There were no barriers for this patient to have the conversation. He understood, and he agreed to basically all the statements that we have presented and the reason why he needed to have that in place. When we were discussing about the patient's goals in a long term, his answer was that he wants to live as long as God allows him to. Taking the opportunity that the patient was understanding all the concepts of end of life. So we also discussed about the chances of having an advance directive, also completing the paperwork so we have that at home in case of emergencies. So with this patient in specific, he requested to have CPR as needed, and he does want to be intubated and resuscitated if it's necessary, and still, possibility for him to have a normal life afterwards. When we asked the question about having a life support, the patient agreed, and he said that as long as the doctors, myself, can provide the good views or a good feedback about having the life support treatment, then he's all in with the possibility. When we discuss about a permanent brain damage or any other situation like this, he said that he would like to be on a life support unless there's no progress of not getting better in the condition determined by his doctors. The patient was very specific when we were discussing the stages close to death. And he mentioned that he wanted to have, when the time comes, an ending with dignity and comfort. So he specifically mentioned something about not suffering or having pain. That's why we also mentioned about having hospice included as a part of the treatment for end of life, and he agreed to that possibility. The patient has refused any type of surgery if the necessity comes. He refused any new treatment, dialysis. The patient refused also to be transferred to nursing home facilities or rehabilitation programs. The patient has mentioned that he is not okay with having blood transfusion due to religious reasons, and that we need to respect that, and we do. At this point, also we mentioned about hospitalizations, and he says that he doesn't want to go back to the hospital for any reason, that he just wants to stay home. And when the time comes, he just wants to be comfortable at home. As per the patient, his wife is the one assigned as a power of attorney, and in case needs to be used. So at this point, we have concluded that the patient's wife is the one assigned as a healthcare proxy and power of attorney. Other things that we discussed with the patient was the possibility of being an organ donor after his death, and the patient specified that he doesn't want to be a donor. So, and that we need to respect his wishes. To conclude, the patient has determined that after his death, he wants his wife to organize all the memorial, and he wants all the funerals to be arranged by his wife, including music, specifically Christian music during the funeral, He wants to be remembered as a loving and caring for everybody around him, his family members and closest friends. Once all the papers were filled out, some of the papers he kept to take it home and review, and then he would resubmit it with his wife and signing off everything. Some of the papers, like the healthcare proxy, is already signed, but the advance directive has to be renewed, and he just needs to send it over. This patient has completed all the papers at this point, and what's left over to do for this patient is completing a lab work so we can update and follow up with the conditions of his. We're gonna check the A1C levels to see how the diabetes is managing from the last time and to compare. We're also checking cholesterol. The patient has not eaten anything, so he's fasting. This is a good chance for us to review cholesterol level, and so we also will include the PSA level as well. So everything included, and then we review in 2 weeks once the results come back. We have completed a successful visit today with our patient, 80 years old patient. So we have arranged for all the paperwork to be in place for the future as a long term. And so everything is just clarified today. We also have arranged transportation services for the patient to go home, and also to establish the relationship with the transportation services for future visits, coming to the clinic or going to medical appointments at the hospital sites.